Do fluoride supplements harm children? FDA panel debate explained. A heated debate over whether fluoride supplements harm children has sparked intense discussions at the Food and Drug Administration, FDA. A panel meeting Wednesday focused on whether ingestible tablets pose risks to children's microbiomes or contribute to long-term dental health. Pediatric dentists argue that chewable fluoride supplements, available only by prescription, are vital for families in regions without fluoridated water who may lack dental insurance or financial resources. However, Commissioner Margie McCary has pushed for their removal from the market, citing concerns about their potential side effects. Advocates and critics at the event disagreed on basic scientific methods, emphasizing the importance of responsible dental practices. During the public meeting in Silver Spring, Maryland, dental experts outlined a balanced approach. Dr. James Becker, a Utah Dental Association member, emphasized that too little fluoride can weaken tooth enamel, while too much causes fluorosis, a condition visible on teeth. He highlighted areas where community water fluoridation already exists, but many regions lack such programs or naturally occurring fluoride. In contrast, Dr. Dil Osmundson, a retired dentist now working for the Fluoride Action Network, criticized the current practice. He questioned how he determines child fluoride needs, asking, "Where do you live?" This exchange aimed to assess Dr. Becker's competence. Dr. Johnny Thompson, president of the American Fluoridation Society, supported the supplements, arguing they help prevent cavities. Critics, however, relied on studies that did not fully prove their claims. Dr. Gary Moran of Trinity College Dublin noted that ingesting fluoride may have limited impact on oral and gut microbiomes, but more research is needed. Dr. David Kroll from the American Academy of Pediatrics advocated for fluoride supplementation as a tool in maintaining strong teeth. "We need to continue conversations between pediatricians and patients," he stated, stressing the importance of multifactorial approaches. Even though Medicaid covers oral health, fewer than half of children use dental visits regularly. Cavities that erupt can worsen if left untreated, often leading to widespread damage. Dr. Stephen Levy explained that such decay impacts bone and blood flow, making it a significant concern. Public health organizations recommend fluoride supplements for children starting at 6 months when water is fluoridated. Over-the-counter vitamins don't contain fluoride, while supplements are available in toothpaste and mouthwashes. Critics argue that the FDA-approved supplements never required rigorous testing before approval, raising concerns about their safety and efficacy. Linda Birnbaum, a toxicologist, acknowledged the importance of understanding benefits, while Dr. Brett Kessler of the American Dental Association emphasized that prescriptions should only occur after careful discussions with parents. Erica Edwards, a health and medical news writer, concluded the session with a call to action. "I hope we can filter out all the noise and take a breath." FDA debates fluoride supplements, safety and freedom of choice. The fluoride debate is at a crossroads. Should parents have the right to use supplements their children might need, or should the FDA prioritize potential health risks? This isn't just about tooth decay. It's about medical autonomy. Let's unpack this volatile discussion. Robert Kennedy Jr. has framed fluoride additives as a compelled medication issue. "We shouldn't force parents to accept something they could get voluntarily at a drugstore," he argued in April, after Utah became the first state to ban fluoridated water. His stance champions medical freedom. Yet the FDA, which he oversees, now seeks to remove oral fluoride supplements from the market, sparking accusations of contradiction. On Wednesday, the FDA held a critical hearing to assess these supplements, which dentists often prescribe for children in non-fluoridated areas. The agency has already declared its intent to take action by October 31st, emphasizing safety concerns like brain development impacts, thyroid disruption, and gut microbiome changes. But parents and dentists are pushing back hard. Here's the irony. Utah's fluoride ban inadvertently expanded access to supplements by letting pharmacists prescribe them. Yet some FDA critics claim removing these options would undermine the very freedom Kennedy advocates. "This risks leaving families without crucial defense against cavities," warned a Utah parent in public comments. "Don't take our choice away," pleaded a dentist, who described supplements as essential, while Florida's Dentist Association called them a last line of defense post-fluoridation bans. The debate exploded during presentations. George Tidmarsh, new head of the FDA's drug division, clashed with a Utah dental professor over fluoride dosage assessments. "We need rigorous data, not opinions," Tidmarsh insisted, dismissing personal testimonies like the parents who credited supplements for improved dental health. Anti-fluoride advocates like Mil Osvitson, however, grilled the professor about accounting for all fluoride sources, food, medications, before recommending supplements. The science remains contentious. While dental groups emphasized fluoride's cavity-fighting benefits, some researchers accused supporters of cherry-picking studies. The FDA safety review now hangs over this fractured landscape. But Tidmarsh left the door open. Removing supplements won't block future research. We're not condemning them forever, just ensuring rigorous scrutiny. Two priorities clash here: individual choice versus perceived public health risks. Should the FDA protect the population or respect parental rights? The agency's October deadline looms, but this battle won't end with their decision. As one Utah comment poignantly asked, how do you balance freedom to choose with freedom from harm? Debate hums in dental offices nationwide. Florida dentists warn of rampant tooth decay. Without supplements, Utah parents demand to keep options. The FDA seeks to prevent potential neurodevelopmental damage. A ultimate question: is this a medical freedom fight or a necessary precaution? Who should decide? Scientists, parents, or the government? Your thoughts matter. Do you support the FDA's proposed removal or believe parents deserve final say? Let's hear your perspective. Prescription fluoride faces FDA ban. What you need to know. Amidst growing controversy, the U.S. Food and Drug Administration, FDA, seems resolute in its plan to prohibit prescription fluoride supplements, despite their increasing relevance in the eyes of numerous experts. According to federal data from 2022, a vast majority of U.S. residents reside in areas where fluoride is added to the public water supply. However, this year witnessed a significant shift as Utah and Florida became pioneers in outlawing the practice, with several other states considering similar measures. Fluoride, a naturally occurring mineral in certain foods and groundwater, plays a crucial role in preventing tooth decay. By reinforcing the tooth enamel, it combats the acids produced by bacteria, plaque, and sugars in the mouth. Since its introduction in the U.S. in 1945, fluoride has been hailed as a public health triumph by many experts, including the CDC. In regions devoid of fluoride in the drinking water, fluoride tablets or drops are often prescribed for infants and children to mitigate the risk of tooth decay. Following alterations to the public water supply in Utah, there was a notable spike in fluoride prescriptions. Analysis by Epic Research revealed a 30% increase within months, escalating from approximately 1% at the beginning of the year to 1.3% by May. Despite this, the FDA announced in May its intention to withdraw ingestible fluoride prescription products for children from the market by the end of October, preceding the required safety assessment and public consultation phase. On Wednesday, the Reagan-Udall Foundation convened a public meeting to debate the advantages and disadvantages of prescription fluoride supplements. Numerous professionals, including dentists, researchers, and public health experts, expressed their views, with many organizations advocating for fluoride, such as the American Dental Association and the American Academy of Pediatrics. Dr. George Tidmarsh, the recently appointed director of the FDA's Center for Drug Evaluation and Research, emphasized the necessity of balancing risk and benefit, highlighting the lack of data in the initial presentations. He singled out two studies indicating potential hazards, including a federal review linking high fluoride exposure to reduced IQ in children. Critics argue that this research lacks context, as the risks are associated with exposure levels significantly higher than those in the U.S. Experts acknowledge the need for further investigation to comprehend the risks and benefits of fluoride supplements comprehensively. Dr. Susan Fisher-Owens, a pediatrician, discussed the relationship between fluoride and neurocognitive development, hoping that the FDA would reconsider its stance based on evidence of safety at U.S. recommended levels. As the national discourse surrounding fluoride intensifies, healthcare providers report increased inquiries from patients and parents seeking clarity on the risks and benefits. A recent poll by CareQuest Institute for Oral Health revealed that the majority of U.S. adults support community water fluoridation, However, removing fluoride without a strategy to assist affected communities could exacerbate the oral health crisis. An analysis by Truveta indicated that fluoride prescription rates among U.S. children have been declining, but states with less common community fluoridation have consistently higher rates. The trend was attributed to enhanced provider-patient discussions regarding fluoride sources and cavity risk assessments. Some speculate that the decline may be linked to heightened skepticism towards government intervention post-COVID-19. As community water fluoridation decreases, experts emphasize the significance of maintaining the option to use prescription fluoride supplements. Legislation in Utah, which prohibited the addition of fluoride to public drinking water, included provisions to broaden access to prescription fluoride, highlighting the value of personal choice. Dr. James Becker underscored the importance of having supplements available as the sole means of obtaining fluoride benefits in non-fluoridated areas.